844-500-4242. Once a month, we are joined by Dr. Matt Callahan, the house veterinarian of the Howie Carr Show. He is here to answer all of your questions about your house pets, mainly your cats and dogs, but he can take a chance at
you're to answer most of your questions.
Most of the questions. That's a good way to put it, Dr. Matt. And it's always a pleasure to have him. We always have full lines. People enjoy having him. And we have breaking news to discuss today. But first, I should say that Matt the Vet is brought to you by the Eden Pure Thunderstorm. For all your pet odors, get the Thunderstorm Air Purifier today at EdenPure.com, code word Howie BOGO. The Thunderstorm Air Purifier. Dr. Matt has several for his animal clinic, and that's a good recommendation, Dr. Matt, isn't it?
I just wanted to say, we don't discuss this beforehand, so this is off the cuff. We had someone say last week how nice it smelled in the clinic, which is unusual. I mean, everyone knows what a veterinary clinic smells like. It's either horrible or that disinfectant smell that
right.
I like worse. And so I just, said thanks and just let it go. And then this morning, someone said the exact same thing. It really smells nice in here. So that's exactly what happened. So
boy, that's the best endorsement I've heard ever. All right. Let's talk about, and again, whatever questions you've got, give us a call at 844-500-4242. But first, I have to ask you about Lady Gaga's dogs. As you know, two of her French bulldogs were dog napped the other night. They tried to get the third one, but the dog walker, who was a very loyal friend of hers, apparently, he even though he was shot 4 times, he hung on to the black one. And they made off with the other two. So what I've been asking myself, and people have been asking each other, is what about chips for dogs? Yeah. How do you? And my guy who works with me down here, he has a collie and a Sheltie, and they both have chips. But I guess you have to take them to the vet to activate the chip. Why don't you explain how the whole system works?
Sure. There's 2 kinds of pet ID. There's the chips that we normally think of, the injectable chips, which are called RFID chips, or radio frequency identification chips. And they need a chip reader. And that could be a veterinarian, it could be a dog officer, an animal control officer, or someone like that has the reader and passes the reader over the chip, and it responds. The other type is the GPS chip that we'd sort of like to have and think about. Most of those are on collars. And of course, the first thing that someone that dog naps a dog is going to take the collar off.
Okay. So that wouldn't, in this case, that wouldn't work to get Lady Gaga's dogs back, or any dog that gets stolen.
A month from now, a year from now, someone, believe me, crazy as it seems, they'll bring him to the veterinarian, and the veterinarian I've had this happen more than once, where the story just doesn't seem to be quite right. And so you go, okay, let's pass a reader over this chip. And it turns out that it's somebody else's dog.
But those are the injectable chips,
right? They look like a big syringe, and the chip, it goes through the center of the needle into the dog. Right.
Okay, so if someone brought a dog to your clinic and had the chip, and had the injectable chip injected, right, then you would just then run the scanner over it, and then they would be recorded for.
Right. Well, what happens is if I run the scanner over it, it comes up with a number, like a 15-digit alphanumeric code.
Okay.
And then because of the code, I can find out who was the representative for the chip. I call that number. Someone answers the phone, hopefully, and says, how can I help you? And then I pass the chip along, and they say, okay, this is the person who owns this dog.
Okay. But it's not like a device on a car. So that if a car is stolen, you just track it down to the McDonald's parking lot or wherever the hell it's abandoned.
Right.
Okay.
It isn't like that. They do make collars that do that, where like on your phone, you can track another phone, right, or you can track your car.
And those typically need a battery source, right?
Sure. They don't need that much, but that's probably why they have to be on a collar, because they're not transponding, they're transmitting.
Mm-hmm. So would you recommend an injectable chip?
Oh, I'm a huge fan. We have found dogs. We found a cat 2 years after it was lost. We found a dog 6 months after it was lost. So we find pets all the time through their chips.
Well, who had the cat 2 years later, or the dog 6 months later?
Okay, so with here's one of the things that people don't appreciate about this. I had a client about 2 years ago, and they called me and they said, my cat is lost. And I said, perchance do you have a chip? And they said, yes. And I said, call the chip manufacturer. And 5 minutes later, I got a fax saying the cat was lost. Well, I already knew the cat was lost. That was unimportant to me, but I also knew that every dog officer and every veterinary clinic within 20 miles just got that fax. So the word is out, right, that there's a pet that's lost. Now, in the case of the dog, it was lost north of the Merrimack and found south of the Merrimack. And this is back in the day when most of it was done in newspapers. The internet wasn't quite as sophisticated as it is now. And so people were advertising for the lost dog north of the Merrimack. And in Hamilton, where the dog was found, they were advertising for a lost dog, but no one ever got together. The dog actually came to my clinic, was about to be adopted, and the owner and the person that was now sort of sheltering the dog said, this dog was definitely owned by someone. And I said, has anyone checked for a chip? The answer was no. We scanned the dog, found the chip. The dog, the client was actually, we came up with a client living in San Diego, which couldn't be right. So we called their contact number. They said the people had moved to Salisbury. Lo and behold, called them in Salisbury, and 45 minutes later, after 6 weeks of being lost, the dog was back home.
Wow. So I got to ask you the obvious follow-up question. How much does the chip cost?
They're very inexpensive. To implant the chip is usually between $60 and $90. And then there's a yearly fee, which isn't actually terribly high, $18 to $20 to maintain your dog's information at that site.
Sounds like a better deal than getting a license from the town, for which you get nothing in return.
Well, right. I mean, it's the licenses help, rabies tags help, and these things help. So you can use all these bits of information to track down an owner.
Oh, that's interesting information. Yeah. So the chip's not going to help Lady Gaga get the dogs back.
Well, again,
the $500,000 reward is probably what's going to help.
Right, that's going to help. But let's say 6 months from now, someone brings this dog to a vet for some problem, and the vet gets any sort of weird vibe about the thing and runs if the dog has a chip. I wouldn't be shocked if they do. Then they scan the chip and then they find out who the owner is.
Right. Well, I mean, French bulldogs too. I mean, they're usually owned by people of some affluence, right? So I mean, so if these guys are like street criminals,
right?
So if they suddenly these are the kind of people who, I hate to stereotype, but they're the kind of people who have pit bulls, not French bulldogs.
Not Frenchies, right?
Yeah. Right. So I think they would probably raise the suspicion of any vet that's paying any kind of attention.
Well, here's how the situation could play out. They bring the dog in. The dog is 4 years old, and they say, "Where's the dog's past veterinary records?" Well, we don't have any past veterinary records. Well, where did you get the dog? Well, we got him through a shelter. Well, what shelter? The story falls apart so quickly, and we've had it. As I said, we've had it happen where dogs have been taken from a person or taken from a shelter, and then they try to bring them in to get them spayed or to get them rabies vaccinated or anything like that, and then the story starts to fall apart.
All right, where should people go, Dr. Matt, or what's your phone number if people want to, and where is your clinic, by the way, if people want to get an injectable chip or anything else in their dog or cat?
I run the Ipswich Animal Hospital. We're on Route 1 just over the Ipswich-Raleigh line, so our number is 978-948-8189.
978-948
8189.
8189, Ipswich Animal Hospital. Okay, we took up a lot of time there discussing this, but I think it was good information, and it's pretty topical information too. So
do the read. We'll take calls when we come back.
When we come back, we're going to take a lot of calls. We've got a lot of people that have a lot of questions for Dr. Matt. This week is the week you've been waiting for. My friends at Eden Pure have brought back the ever so popular Thunderstorm Air Purifier BOGO offer. That's buy one, get one free. This offer expires Sunday, February 28th at midnight. With over 60,000 sold, the Thunderstorm is slated to sell out, so take advantage of this offer while supplies last. If you bought one and love it the way I do, then order now and you'll have two. Debbie from Auburn, Maine wrote, "Wet dog, sausage, and cigars were no match for the Thunderstorm." You just heard what Dr. Matt said. He's getting compliments on the way his animal clinic smells. That's a new thing for for anybody who's ever been in an animal clinic. My listeners love the Thunderstorm Air Purifier. Matt the vet loved it so much, as I just said, he bought 2 more. The Thunderstorm is a small device you can hold in your hand and plug into the wall to purify the air from any odor. It could be the pet odors, kitchen smells, tobacco, or that damp smell lingering in your basement. When you take advantage of the BOGO offer, the Thunderstorm is below $100, and it doesn't take up any room, as you can see if you're on social media. Also, no filters are needed. Take advantage of the BOGO offer before it expires or supply runs out. Go to EdenPure.com and put in code word Howie BOGO. Remember, it runs out this weekend, the BOGO offer. That's EdenPure.com, Howie BOGO. Shipping is free. I'm Howie Carr.
The paper boy with a big microphone, Howie Carr.
All right, let's take some calls. And again, Dr. Matt, where can people go to reach you if they need some help with chips or anything else?
Yeah, they can call me at the Ipswich Animal Hospital at 978-948-8189.
All right, Lynn, you're next with Howie Carr and Dr. Matt Callahan. Go ahead, Lynn.
Thank you. I have a kitty, and she has kitty acne, and no matter what I try to do, I can't seem to get rid of it.
Right. Okay. What sort of food bowl are you using? One water bowl?
I have used something the vet gave me. It was some sort of like antibiotic topical thing, and it's just like irritating. And I've been using the acne pads.
Yeah, I think these are very difficult to control. So you don't think about curing it, think about managing it. Certainly, I think in some cases I might even check them for skin mites. That's an oddball thing in cats, but definitely has happened and causes acne. The other thing is to change their food bowls from metal or plastic to ceramic or glass.
Thanks for the call, Lynn. I was going to make a stupid joke about kitty Claricel.
Well, they actually, some cats actually do respond to benzoyl peroxide, just a very weak version of it because their skin is so sensitive. But
wow,
does the same thing.
Paul, you're next with Howie Carr and Dr. Matt. Go ahead, Paul.
Hi, Howie and Matt, Dr. Matt, calling from Wayland. I'm a dog lover, and I have had about 5 or 6 dogs over my lifetime. My daughter recently, within the last year, got a border collie.
Yep.
And I was delighted that she did that. But this dog seems to hate me from the very beginning. It's been barking at me the whole time.
Have you been mean to some sheep, Paul? That may have turned the dog against you.
Not intentionally, Howie, but or
past life.
But the dog just recently got neutered.
Yeah.
And supposedly that's going to help.
Yeah, that's always
sprayed it with water and maybe with vinegar when it barks.
Okay. Well, that probably will alienate your dog. I guess I would say this, that bribery definitely helps with dogs. So you want to, I don't think punishing them for barking at you or even mildly punishing them is going to help your relationship with them. I certainly think if we talk to veterinary behaviorists, virtually every behavior problem, if they are not spayed or neutered, they say first spay or neuter them, because in most of those cases, the dog gets better. But you want to be the positive influence on this dog. So you want to give them treats, you want to feed them dinner, you want to fill their water dish, you want to take them for walks. And then those sort of things will help endear you to the dog. This, not liking someone, that doesn't have to be forever. Dogs can learn to like people.
Thanks for the call, Paul. Mick, you're next with Howie Carr and Dr. Matt. Go ahead, Mick.
Hi, Dr. Matt. Thank you for taking my call. I have this cat that I got from the local shelter, and it's a calico, and it turns out to be a scaredy cat. That is, I can't touch the cat except when I'm at bed, and it wakes me up at 4:30 in the morning and pats me on the nose and says, "Give me attention now."
Yeah.
And I'd like to adjust the time zone of this cat.
How long have you had her?
About 6 years now.
Oh, good. So it's not. She hasn't established a pattern yet. So this is a toughie because cats are all about. I mean, cats would love. Groundhog Day is what the cats would love, living the same day again and again. So I think you're going to have problems unless you can lock the cat out of the bedroom for a period of time, which of course they'll respond by crying at your door. So I think you're in trouble on this one. I think the cat's established the relationship, and we have a clinic cat that has a very similar issue. The cat likes me on one day a week, Sunday morning, because I have to come in and feed the cat. So other than that,
why don't you feed the cat 7 days a week then?
Because I don't want to. That's why I hire people to feed the cat 6 days a week, but not 7 days a week.
All right. Good luck, Mick. Steve, you're next with Howie Carr and Dr. Matt. Go ahead, Steve.
Hey, Dr. Matt, thanks. Thanks, Howie. Can you hear me all right?
Yeah.
So we have a 5-month-old female golden. She goes through the night without urinating. She does fine, but she has those accidents when we get home. We leave her at this point from 9 to 3 when we're at work, and when my wife gets home, I don't know if she gets distracted. She goes out, but she doesn't pee. She doesn't urinate outside. She comes back in. She has 1 or 2 accidents. Sometimes she'll go through the day. She's fine. But she'll have 1 or 2 accidents like 4 times a week, 3 times a week.
Okay. Is she doing it while she's greeting you, or is she just going over and urinating?
She's sometimes maybe we'll miss a signal.
Yeah.
But
no, I'm saying is she peeing while she's greeting you? Is she so happy to see you that she's urinating?
No.
Okay.
No, this is when no, she's not.
Okay. So here's the thing, we invented indoor plumbing because we didn't want to go out there. Okay. So you can't blame your dog for going in the house. It makes a lot more sense. But the thing of this is if you let her out and she doesn't pee, you have to come back and put her in a crate or someplace like that where she doesn't want to pee. And it just has to be for a few minutes because she's probably waiting to come back and pee. So when you let her out, if she does not urinate outside, she needs to come in and go into a crate. And then in 5 minutes, let her out and she'll go.
I think some people don't like crates. I mean, the pugs loved the crate. So it just depends, doesn't it, on the dog, whether they want to be in a crate or not?
I absolutely agree. There's some dogs that will not accept it, but the vast majority will, as long as it's not used as punishment. It's just a place to go. I mean, kids have cribs. They look a lot like, crates, but people put kids in cribs all the time.
Right. Sometimes they put things on top of the crib so that the kids can't get out.
I'm not commenting on that.
I'll cop to that.
All right.
We'll be right back. I'm Howie Carr. Dr. Matt, what is your phone number if people want to use your services during the week?
My phone number at the Ipswich Animal Hospital is 978-948-8189.
And if you bring your pet there to the Ipswich Animal Hospital, it smells really good because they use the Eden Pure Thunderstorm. 844-500-4242. A texter wants to know, would Dr. Matt recommend pulling a German Shepherd's tail after taking a shower?
I recommend strongly against that. At all times, not just after a shower.
Yeah, with all due respect to the Commander-in-Chief. Kelly, you're next with Howie Carr and Dr. Matt. Go ahead, Kelly.
Hi there. Dr. Matt, I have a Bernese Mountain Dog.
Yep.
And he's older, and it's not his breath that is so terrible, but it's like his lips are really stinky. And so what do I do? Okay.
So certainly it can be their teeth that can cause this. Dogs also, burners can get this too. It's called lip fold pyoderma. Dogs have this little fold sort of in the middle of their bottom lip, and it can get all sorts of saliva and food and other junk in there, and it really starts to ferment. So
they need to floss.
They probably need, I would say certainly have this looked at by a vet, but something simple like, anything astringent like a mild witch hazel on like a cotton swab can help that.
All right, Kelly, thanks for the call. John from Portland, you're next. Go ahead, John.
Hi, thanks for taking my call. I have an indoor-outdoor cat, and she gets this black crud around her mouth that seems to come and go. Is that anything I can do anything about, or that I need to worry about?
I think we just covered this on the last couple of calls.
It's the same thing on a cat?
Yeah, chin acne or lip fold pyoderma, these are all similar things. So, yeah, I think probably what I would do in this case, in this particular case, is any sort of gentle cleanser, a mild soap or anything to help soak that stuff off. As long as the cat will tolerate it, most cats will. A little warm, mild soap on a cotton swab just to keep it clean.
Is it worse because the cat's outside sometimes?
And I can't think of any reason why it would be worse, but we have indoor cats and outdoor cats with the same issue.
Thanks for the call, John. Mike, you're next with Dr. Matt here. Go ahead, Mike.
Yeah, hi, Dr. Matt. Thanks for taking my call. I got a 5-year-old Australian Shepherd.
Yep.
And may not have noticed it when he was a pup, but for years now, he when we take him out for a walk, he periodically hops, or
like walks on 3 legs.
With a limp.
Yeah. Okay.
Yeah, he just every once in a while. It's not constant, but every once in a while, he just hops like on his back leg, like it's like a sore or something.
Yeah.
So I don't know if it's anything serious. He doesn't seem to be in discomfort. It doesn't happen all the time.
Well, I would say,
but I was just,
if he's hopping, it's probably because he's uncomfortable. Aussies are pretty tough dogs, so if it's a mild pain, they're probably going to just walk through it. I would have a veterinarian absolutely take a look at this. Luxating patella, where their knee pops in and out, that's a real common one for them to be suddenly lame and then suddenly not lame. Also, dogs can have hip issues, hip arthritis, or anterior cruciate disease is another pretty common one. But this is definitely one for an exam.
Thanks for the call, Mike. Is that a particular problem for those kind of dogs? Because every dog seems to have these different kinds of problems.
Yeah, oh, absolutely. Every breed has their own specific orthopedic disease or genetic disease or heart disease or something like that. Yeah.
Yeah.
But I don't think Aussies are particularly prone to any of those diseases, but they can get all of them.
Lisa, you're next with Howie Carr and Dr. Matt. Go ahead, Lisa.
Hi. Yes, I just had a question. So I have a 6-year-old pit bull retriever mix who is he gets very stressed out getting his nails done to the point where I've brought him to the vets. We've tried to give him medication orally.
Sure.
It's not doing anything.
Yeah.
The last time he was at the vets, they actually tried to sedate him like he was having surgery.
Sure.
They had to put him under twice.
Yeah.
He still would not go under.
Yeah.
I don't know what to do with him.
He does actually have to go under anesthesia. So they're trying to sedate him. Dogs can fight sedation. I think he needs to be treated like a surgical patient and be put under anesthesia for his well-being and the vet staff's well-being. If they put him under anesthesia, he will not wake up because he's under anesthesia. So if he's been put under appropriately, he will sleep to the point where they can trim his nails appropriately. Then he'll wake up without any stress. But that's what needs to happen.
How much time does a dog need to spend outdoors so that you don't have to worry about these kind of problems taking them to the vet?
Every dog is different based on the strength of their nails and what they're even walking on outside. Dogs that actually, need the least amount of nail care walk on the pavement because the pavement acts as a
city
big emery board. Right, city dogs, absolutely. The dogs that are out in the country walking on softer surfaces, they tend to need more nail care. And I bet there was almost a 10-year period where I didn't trim my golden retriever's nails. And then as they aged, it was every couple of months.
Wow. It's tough to, and you can't really trim the nails yourself in your house because they're going to bleed, right? Because they're not like our nails.
Right. I mean, if you cut your dog's nails, eventually you're going to quick them and they're going to bleed. So yeah, I think people say, well, I'm afraid of quicking them. And my response is, we're not. We'll go ahead and quick them because it's just one of those things that happens. You can't help it if you trim enough nails. But they definitely need them trimmed, especially this winter there's been so much ice. I know it's been a problem for you, Howie, with all the ice on the ground, but we've had tons of broken nails.
Take it up with him if you say I'm rubbing it in. I said nothing. Dr. Matt said it.
So we've really had a lot of nail injuries. And my joke is with nail injuries, the worse they are, the better they are, because if they tear them right off, there's nothing for me to do. I'm done. So,
thanks for the call there, Lisa. Bill, you're next with Howie Carr and Dr. Matt. Go ahead.
Hey, Dr. Matt, I have a question for you. Quick one. I've inherited a psycho dog.
Yep.
My daughter has a little dog. It's like 2.5 pounds of mutt that her ex-husband gave her, and she came home with us, and it follows my wife around everywhere.
Yeah.
Like right behind her, does not leave her alone.
Mm-hmm.
And when she's out of the house, everything's fine. If my wife is there, you come walking in the house, she'll bark at everybody.
Yeah.
And then she tried to nip at everybody. but it's almost like she's trying to protect her.
Right. She is. That's because she is.
I don't know what. And I don't know what to do. I mean, it doesn't matter. Like, I can walk outside and come right back in, and she'll stop barking at me.
Right. Treat you like a stranger. Sure. Yeah, she probably is trying to protect your wife. A good thing to do here, they make small cage muzzles for these guys, and that can help. You can always keep her on a leash, at least until she's trained. I really do think people have a lower expectation for small dogs as far as behavior, and I think that's wrong. I think you can expect good behavior out of a small dog, but you have to train them. So you have to train them to come when they're called, train them to sit, train them to take treats, all that sort of stuff, and then they start to respect you. At least you can control them with your voice or a leash.
What about what you were talking about earlier, Dr. Matt, bribery? Why doesn't Bill just start feeding the dog, and Bill gives him all the treats?
The dog likes Bill when his wife isn't home. That's the problem. The dog doesn't dislike Bill. The dog is trying to protect Bill's wife. That's what the dog is trying to do. So, but if you ask the dog to do stuff, now the dog has to behave for you. That's why it's a little bit different.
Thanks for the call, Bill. Paulette, you're next with Howie Carr and Dr. Matt. Go ahead, Paulette.
Hi, Dr. Matt. I have about 9-year-old female. Well, obviously she's female because she's calico, long hair. Yeah. Actually, my husband and I went away last week. We're in Florida, actually, Howie. And we had her boarded at a place that we've already had her boarded. This is the second time. So we brought her home. She was meowing like crazy, like really crazy, like meowing all the time. Yeah. So I started feeding her like a normal schedule. This morning, I went down in the basement and I noticed there were like at least between Wednesday and today, like 8 piles of puke in different areas. Mm-hmm. Now she seems to be drinking an awful lot of water. So I'm not really sure what is going on with her. I don't.
Yeah. Your cat definitely needs to go to the veterinarian and get checked out. Certainly cats after the age of 9, cat that's drinking a lot can have some kidney issues. They can have diabetes. They can have thyroid issues. All of those things can look like this, but I wouldn't waste any time. I would call your vet ASAP and get her in to be seen.
Thanks for the call, Paulette. John, you're next with Howie Carr and Dr. Matt. Go ahead.
Yes, hi, Dr. Matt. This is John Kerry. I'm from Saco, Maine, Howie, not far from your favorite place down there at Ken's place in Pine Point.
I know Saco very well.
Very good. We enjoy your show very much, and Dr. Matt as well. We have a pretty difficult question. We have an 11-year-old lab. Mm-hmm. She has arthritis, and she has a very severe skin disease. Yep. And the vet
do you know what it's called?
Almost recommended putting her down, and we don't really want to do it. Okay. But we want to do the best for her.
Okay.
What's the disease? Do you know the name of the disease, John?
No, I do not. It's a skin disease. It's a rash. And she scratches herself so severely that it's raw on certain parts of her skin. Yeah.
Sure. Okay. Well, certainly if you're going to pursue this, you might want to pursue it through a dermatologist. There are specialties in veterinary medicine. You can certainly look at a veterinary dermatologist to help you out here. Your vet usually is pretty, most vets want to see their patients get better. Certainly in the cases for me where, I think it's beyond my capacity, either intellectually or via some piece of equipment or some imaging, I send the cat or dog along to be looked at. And so vets are usually pretty happy to do that. Orthopedically, old labs are tough. But I do think there's enough medications out there that the vast majority of labs can have their orthopedic disease managed to the point where they die of something else. I know that sounds weird, but you don't want to put a dog to sleep just because of orthopedic disease. It seems, especially in the case of labs, because they, I always joke about labs that, you have that 14-year-old lab that can't see, can't hear, and it hurts to get up, and they just want to get the day going. Let's get some breakfast and let's go on. That happy-go-lucky attitude is just a veneer around a titanium core. So they are the toughest dogs out there for sure.
All right. Thanks a lot, John, and good luck. And I'll see you at Ken's this summer. I'm looking forward to it. All right. Dr. Matt, again, what's your phone number if people want to get your services at the Ipswich Animal Hospital?
My number is 978-948-8189.
All right, great. We'll be back and we'll have one more segment. Get on board now at 844-500-4242. I'm Howie Carr.
A nightmare to liberals everywhere. He's Howie Carr.
844-500-4242. Matt the Vet is brought to you by the Eden Pure Thunderstorm. For all your pet odors, get the Thunderstorm Air Purifier today at EdenPure.com, code word Howie BOGO for the 2-for-1 deal. And Dr. Matt, what's the number people can reach you at the Ipswich Animal Hospital during the week?
They can call me at 978-948-8189.
And by the way, we have full lines right now. And if we run out of time, hang on the line if you're on the line, and Dr. Matt will take you off the air. We appreciate that, Dr. Matt. Thank you very much. 919 asked me, when are you going to get back into the dog owner game, Howie? There's a dog out there waiting for you to adopt him or her. Yeah, I just got to convince the mailroom manager. That's all. Help me out, Dr. Matt, with that,
Okay. I'll make it my personal project.
I've already got the names picked out for my 2 new pugs, Roscoe and Elroy. I don't care if they're male or female. Those are going to be their names, right?
They don't care. Yeah.
Exactly.
Just don't call them late for dinner.
Joe, you're next with Howie Carr and Dr. Matt. Go ahead, Joe.
Dr. Matt, I got a Maltese, and the dog is old and kind of deaf, and I want to teach her how to sit and like stay and stuff like that, but she doesn't do it, and I don't want to hit her.
Hey, well, I'm glad you don't want to hit her.
Joe, shouldn't you have done that when she was a puppy? Taught her how to sit. Why did you wait until all these years? Joe. Oh God, Joe. Beth, you're next. Thanks for the call, Joe. Beth, you're next with Howie Carr and Dr. Matt. Go ahead, Beth.
Hi, I was calling about my dog, and he's 10 years old, and his eyes just tear stains, but just it almost pours from his eyes.
Yeah.
And my vet has I had tried eye drops, that didn't work, and then she wants me to put him on Benadryl like every day, and I did it for, and that didn't help.
All right.
And so then I bought this Angel Eyes.
Right.
I don't know.
Well,
That
Angel Eyes
didn't
really
help,
helps with
so-
staining. Yeah, that's one that helps with staining. What happens quite often with these guys is there's a tube that leads from your eyes to your sinuses, and it's called the Nasolacrimal Duct. And for people that cry, I mean, I don't personally cry, but for those that do, they'll get the sniffles because your tears are draining into your sinus, and that happens with dogs too. And quite often it'll block, and then all the tears the dog makes will come out on their face. So, usually what has to happen is you analyze how much tear the dog is producing. If they're producing enough tears and they still have this discharge, then the best, what you can do is unblock the nasolacrimal ducts. I'm not a huge fan of it because quite often it doesn't work for that long, which leaves you with just cleaning your dog's eyes, which,
Yeah, Pearl used to have a
usually the easiest
problem
thing
with
to do.
that too. She but not Gooner. It was kind of strange. What's the latest you can really train a dog to sit or roll?
Oh
over?
no, you can train a dog. I mean, obviously, if they're deaf, you're going to have trouble with voice commands. But you can train a dog at any time in their life. They're just like a person.
Really?
Can learn a new skill late in life. Sure, absolutely.
I thought you can't teach an old dog new tricks. That's not true.
I believe you can. That is not true.
Jim, you're next with Howie Carr and Dr. Matt. Go ahead, Jim.
Oh, hi, Howie. Hi, Dr. Matt. I have a young lab. He's only 2. He's going to be actually 3 in about a month.
Yep.
But he's got an itching problem. Not as bad as the guy before the last one.
Right.
But he just constantly chewing, itching. So we actually changed his food to like a Hill's prescription one.
Right.
But, it was bison because they wanted to change his food. And it didn't work. We were pretty good not giving him anything but that. We ended up Apoquel, which I've read some not so good things about that online, of course.
Sure.
That it like disconnects their immune system, so they're they can get cancers and stuff, and I'm horrified.
Sure.
Of that.
Yeah.
Is that true? Or
well,
is there
I mean, here's the joke. I mean, the coffee mug statement is, "Don't confuse your Google search for my veterinary degree." But the thing about Apoquel is you're never going to read the good things. You're only going to read the bad things. Apoquel is a terrific product. I use it absolutely every day, and I love it. There you go.
Dr. Matt's going to stay on. Hang on, everybody. What's your phone number one more time, Dr. Matt?
978-948-8189.
Thank you very much, Dr. Matt. See you next month. I'm Howie Carr.